Hi, my name is Dave. I'd like to read you a few medical case histories using Laetrile for lung cancer. It offers great hope to the lung cancer patient. First is from a Dr. John Richardson. His book, Laetrile Case Histories. This is a 64-year-old woman with inoperable cancer of the rectum and metastases to the lung. No attempt was made to remove the cancer from the lungs. This is August the 14th, 1975. The patient states that x-rays taken in March 76, 7 months after starting Laetrile treatment, showed improvement in the lungs, and the x-rays taken 3 months later, December of 76, showed no cancer at all in the lungs. The patient was telephoned January of 77 and said at that time, quote, "For a patient who was only supposed to live a month following my May 75 surgery, I'm not doing bad." Her voice was strong. She is leading an active life. Nearly 2 years after the initial diagnosis of inoperable cancer, she had no radiation and no chemotherapy. This should show you that Laetrile does not harm the body, but actually kills cancer cells. Imaging shows no cancer in the body. It's not quackery either. Second case, Dr. Philip Binzel, MD, from his book Alive and Well. 57-year-old man, first seen April the 28th, 92. With a history of a diagnosis of a carcinoma of the left lung 10 months previously. Surgery had been done, followed by one chemotherapy treatment. This made him so ill that he discontinued it. He was then given 25 radiation treatments ending in December of 91. March of 92, x-rays showed extensive growth of the tumors in that lung. He was placed on a Laetrile program and a nutritional diet. X-rays done in July of 93 showed no further growth of the tumors in the left lung. X-rays done 3 months later in November showed that the tumors had all become scar tissue. Scar tissue, Laetrile. What is Laetrile? It's called B17 also. Laetrile is the injectable form of it. Amygdalin is the pill form of it. They're all derived from the apricot seed. It's a completely natural compound. It has a molecule of cyanide in it that destroys cancer cells without harming healthy cells. I hope these 2 case studies persuade you of that. It's cheap. It's available on the internet. 500 milligram pills sells for $85. 10 3-gram vials of the injectable called Laetrile sells for about $85. If you're going through cancer, please consider taking a therapeutic dose. It could be 3 grams, 6 grams of the injectable, 3 grams of the pill form. It prevents cancer. It prevents the reoccurrence if you're at a high risk. In the aftermath of cancer, if you remain on a maintenance dose, it can prevent cancer. It's a wonderful natural supplement. The evidence should be the case studies, not loose talk on the internet. I posted the websites for 60 medical case studies using Laetrile, Dr. Philip Binzel, MD, and Dr. John Richardson, MD. They're in the comment section right under this video. Also 300 testimonial, the website with 300 testimonials, Jason Vale. You can judge those for yourself. The evidence should be something like this. 1981, a major study, Oasis of Hope Hospital, Mexico, 1,080 cancer patients, stage 4, 95% of them. 677 of them on Laetrile survived to the 5-year mark. 240 would have survived had they taken the orthodox chemo and radiation route. Their 5-year statistical success rate would be 240 people. That's a difference of 437 people who were saved using Laetrile that would have been dead on chemotherapy and radiation. Another study, Dr. Philip Binzel, MD, his book Alive and Well, 288 cancer patients, 107 of them. Metastatic cancers, 217 were alive in the 2 to 18 year mark. Most of them in the 4 to 18 year mark after beginning Laetrile. 27 of them would have been alive had they 5 years, had they taken the chemotherapy and radiation route. That's 190 people who would have been dead on chemotherapy and radiation who were alive because they took Laetrile. Please be persuaded by case histories. Just a couple more cases. Dr. Philip Binzel, this is again from his book Alive and Well, a 59-year-old man seen first July 18th, 1980. His history was that 1 month prior to a routine x-ray showed a mass in his right lung. Biopsy showed it to be carcinoma. 5 radiation treatments were given, followed by 1 chemo treatment that made him so ill he discontinued the whole program. He began the Laetrile program and a dietary program. An x-ray done in January of 81 showed that the tumor in the right lung was completely gone. Another case, this would be from the Jason Vale site. You can judge for yourself. August the 30th, 2000. Jim Pruitt had squamous cell lung cancer. The tumor was a little larger than an orange. He just called today updating me on his story from 2 years ago. In October of 98, he started taking 3,000 milligrams of the B17 amygdalin and apricot seeds every day. He started the chemo also. In 6 weeks, the cancer was nearly gone. The radiologist said that they had never seen a tumor that size disappear like that. Jim Pruitt has been on a maintenance dose for the past 2 years, and the remaining tumor biopsy shows no cancer left, but it is only a scar tissue knot. Another case would be January the 12th, 98. Spoke to George Robinson this weekend, and his father was terminal with lung cancer, just got checked up after doing both chemo and the amygdalin B17 pills. He has been taking the B17 pills and the apricot seeds for 2 months. He's having a hard time. He started bleeding. Frank has already had 1 leg amputated due to cancer and has gone through the worst chemo and radiation. He was left terminal, but he's still alive using Laetrile. Another case, April the 17th, 98. Today a man, Tony Johnson, called me who had small cell lung cancer and has been coughing up blood for months. He was on some chemotherapy, and as of 11 days ago, the chemotherapy made his blood count go down to 3, that's his hemoglobin, and 33 for the white blood cells. He was almost crying on the phone when he called today to order some more B17 amygdalin pills, as he told me that his coughing up blood stopped, and his blood count had gone up to 9 hemoglobin and 900 for the white blood cells in 10 days of the B17. He was taking 6 of the B17 500 milligram pills per day and some apricot seeds. His phone number is da-da-da. All this to say, the cyanide molecule in B17 derived from the apricot seed kills cancer cells without harming normal cells. The proof is in the medical case histories, and I believe they're in the testimonial case histories. Judge for yourself. Your doctor may think it's quackery, and he may think it's ineffective. He's not been taught to use chemotherapy. He's been taught to use chemotherapy, but not B17 Laetrile. Know that on the internet there's a war against Laetrile B17. You judge from the medical case histories. Use logic. Use it yourself if you have cancer. If you know somebody that has cancer, lung cancer, any sort of cancer, please give them the good news. Take a therapeutic dose. One case history showed 6 500 milligram pills a day. Otherwise, you can get the injectable Laetrile. Always consult your physician. I'm not affiliated with any B17 company. I'm not selling it. I want people to avoid needless suffering and a premature death from lung cancer. It can be avoided. Take care. Please look into this. Use your good common sense. Trust the case histories. Please. Take care.